The study that I am sharing with you is quite spectacular. In essence, it's a little bit of alchemy. It's a combination of alkaline water and L-Glutamine. When separate, neither one achieved the level of statistical significance. And by looking at the confidence interval, when combined alkaline water and L-Glutamine, you had a nice statistical increase in salivary testosterone during this 3-week study, in which the participants, or the boxing athletes, consumed 400 milliliters of alkaline water during training, plus 0.15 grams of L-Glutamine per kilogram of weight during the event. Now keep in mind, there's a little bit of confounding. The researchers pointed this out during the limitation that a lot of positive studies in alkaline water were done with the consumption of 3 to 4 liters, which was just not practical for individuals during strenuous activity, henceforth 400 milliliters. But now, to proceed with the study as follows. Concurrent ingestion of alkaline water and L-Glutamine enhanced salivary amylase activity and testosterone concentration in boxing athletes. The concentration of salivary testosterone after training increased significantly in group A plus G, but not in group A and G, whereas salivary cortisol concentrations were unaltered. In conclusion, concurrent ingestion of 400 milliliters of alkaline water and 0.15 grams per kilogram of L-Glutamine before training enhanced salivary amylase activity and testosterone concentration of boxers, which would be beneficial for post-exercise recovery. To reiterate a little bit, but goes a little bit deeper into methodology, which is important. The study was conducted in a randomized crossover manner. The participants continued their regular 2-hour boxing training during the study. The training session comprised specific training and sparring techniques. The athletes' physical activities during the 2-hour boxing training were determined using blah, 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 which during training, the participants were asked to consume 400 milliliters of alkaline water during training. Of 400 milliliters of alkaline water and 0.15 grams per kilogram body weight of L-Glutamine. With 400 milliliters of water or 0.15 grams per kilogram body weight of glutamine with 400 milliliters of alkaline water, group A and G, you get the point. So just going through the individual groups per se, the alkaline water, the glutamine, and the alkaline plus glutamine group. Now to proceed, this is where it gets kind of interesting, the backstory. Why did they look at glutamine and alkaline water for this miraculous combination, which delved into increasing salivary testosterone levels and amylase? Proceed. Regarding the effects of acute supplementation, a previous study investigating co-supplementation with glutamine and L-cysteine found beneficial results on energy metabolism and fatigue following endurance exercise. Acute oral supplementation of 0.087 grams of glutamine, kilogram of leucine, 0.3. There's going to be, you can follow DOI citation to the study and delve into this greater on your own. Just giving you the backstory. L-Glutamine increased the rate of recovery in isometric strength, counter movement jump, height, delayed onset muscle soreness, and creatine kinase compared to placebo after eccentrically biased exercise. Please forgive the speed at which I speak, so we cover a lot of ground. Soccer players exhibited improvements in time and distance and reported a reduced feeling of fatigue and self-supplementation with 3.5 grams of L-Glutamine plus 50 grams of maltodextrin 30 minutes before exercise. Co-ingestion of 0.25 grams of kilogram of glutamine and 250 milliliters of water and 50 grams of maltodextrin 2 hours before exercise more effectively prevented anaerobic power decrease and noted in the repeated running-based anaerobic sprint test with intervals, Consistent with previous studies, the present study found that the co-ingestion of alkaline water and L-Glutamine increased athletes' salivary amylase activity, which is beneficial for athletes' mucosal immunity, improved immune status, and can prevent infection in athletes during condensed training schedules and reduce the occurrence of overtraining. Yeah, why the amylase activity? Why was that important? That elucidates why. To proceed, why the alkaline water? Previous studies have shown that daily intake of 3 to 4 liters of alkaline water for 3 weeks can improve combat sport athletes' anaerobic performance in 2 double 30-second wind gate tests for lower and upper limbs with a passive rest interval of 3 minutes bouts of exercise. Drinking bicarbonate-rich water. See, I was not really a fan of alkaline water because of metabolic acidosis, realized how the kidneys work to maintain the pH of the blood, how sensitive that is. But the studies and the outcomes are quite intriguing. Drinking bicarbonate-rich water improved hypohydrated judo athletes' buffering capacity and anaerobic performance. Basketball players supplemented with 2.5 to 3 liters of alkaline water for 6 weeks showed a positive impact on the acid-base balance of the body. See metabolic acidosis, as we discussed earlier, as well as on anaerobic performance in 6 to 28 meter shuttle run. Drinking 4 liters of mineral-based alkaline water for 7 days had a positive effect on urine pH and lactate utilization. After maximal exercise in well-trained soccer players. Can't wait to see the closed caption on that one. In addition, ingesting alkaline water for 5 months led to less severe gastritis and reduced inflammation. An animal study found beneficial effects of alkaline water on aspirin-induced gastric mucosal injury and suggested that these effects may be attributed to its anti-inflammatory properties via inhibition of TNF expression. So that is quite intriguing. So they go, there's the alkaline water, there's the glutamine, let's combine the two and see what happens, and that's what the results they got. Quite impressive outcome. To conclude, in summary, our experiment demonstrated that co-ingestion of 400 milliliters of alkaline water and 0.15 grams a kilogram of body weight of L-Glutamine before training enhanced boxer salivary amylase activity and testosterone concentration. Acute supplementation with alkaline water or L-Glutamine alone had no effect on salivary immune markers or salivary hormone response after training. Again, reference the confounding in regard to the alkaline water, why they had to keep it so low during training. The results of this study indicate the benefits of co-ingestion of alkaline water and L-Glutamine on the salivary immunity and hormonal status of boxers, which might be beneficial for boxing athletes recovering after training, or basically, without any publisher bias, anybody looking to recover from excessive training. What a beautiful, simple, eloquent way that the researchers stumbled on by taking two elements, putting them together, and you have yielding the synergistic effect, the alkaline water, not a lot, just a little bit, adding a little bit of L-Glutamine at 0.15 grams per kilogram of body weight, yielded in a very short period of time a substantial increase in salivary testosterone levels, which could lead to basically enhanced recovery. Again, future studies can be done in larger groups, but still just the same. Quite amazing and a great, great potential benefit for many, many athletes out there in the future. Again, gratitude to the research. Beautiful, beautiful job. And I am humbled you watch and can't wait to see what you and I share next week. See you next time. Bye.